This is Athena Jezik, and today we have a male model to demonstrate with. There's been a lot of comments about getting a male model, so please leave your comments about what you feel about this. If you like male models better than female models, whatever it is you want to leave a comment, please do, so we know how to structure this in the future. And this is Grant. He's a yoga person, so his body is in pretty good shape. Fortunately, he's not really all buffed up, real muscly, with a lot of musculature. But the muscles and the formation of his body is good. The muscles are probably quite well developed. And we'll just see what we find. So there's not a whole lot of difference really between male and female bodies when it comes to massage therapy, because the muscles are basically the same. They might have a little bit different strength or a little bit different tone to them. The bone structure is a little different in a female. Down in the hips, they tend to be wider. Sacrum tends to be broader. And in a male, the hips are narrower and the sacrum is longer and thinner. But other than that, it's really pretty much the same. If you have a male model or a male person on your table who is been doing a lot of weight training, for me, it's very difficult to work that type of a body because the muscles are just too big for me to really get into them appropriately. And they tend to want to have a lot more deeper pressure than what I will do. So I've applied the oil, and then I'm doing like I have always done. I start up at the head and work with the neck and the trapezius muscles, spreading them, working that way. And then running down the vertebrae, remembering that you're going to be on either side of the vertebrae. So women out there, if you're going to help your partner or husband or any friends that are male, just make a note that you might have to go a little bit more pressure, but not much. So you just do it again a couple times. This time I like to go a little farther away from the vertebrae because there's a band here. This is more the belly of it. Even though there's different structures coming into it, you can still feel a nice long muscle, the erector spinae, and then to the edge of that muscle. And again, there's different attachments coming in, but you can still guide pretty much down on that. And then bring it back up. Okay, so once we get that going, you can also do some effleurage moves where you're just expanding your hands out and moving the muscles. It really looks more like you're moving the skin, but you want to meld in with the muscle enough to be able to also take the muscle with you. It's different than just doing a skin rub. So you can really see that there's a difference, but you're not pushing in with a whole lot of pressure. Pressure is not the most important thing to do. So now we're going to go to the side, and this side I'll be starting with. Grabbing the fingers and running along the trapezius muscle along the top of the shoulder, coming right into the attachment on the scapula, working it this way. Down we go. You can feel a lot of different things going on if there's knots, but when somebody is practicing yoga regularly, the muscles have a lot of stretch and flexibility and malleability to them. I think stretching is more important for the body than strengthening. You can gain strength through stretch. The problem with a lot of bulk is that you don't have a lot of flexibility as a general rule, unless you're working at it. And then I just brushed up through that same area that I was just pulling away from the midline, and now just working a little bit into the trapezius on the shoulder blade. Now here's where shoulder blades might be a little different on a man because the muscles will be a little bit thicker, but it's still the same structure. The scapula will wing up. And again, this is a good wing because, again, the flexibility is here. You can take it like so. Just go across the top of the scapula, feeling primarily for any kind of tightness. You can see where there's little red places where I've come through there. That's just where blood is coming up to the surface. There was a little tension through there. Okay, then I come up to the top of the shoulder and working it inward and upward to the neck. You're taking it along this way and upward. Just starting out there at the edge. Now here you're getting onto the edge of the shoulder blade, the scapula, and just working it up. It's a trapezius, basically. Taking it in the opposite direction that we did earlier. This routine that I've done for many years, it works really well because it's effective. You get the muscles, you get a thorough job on the muscles. Taking them both directions. Then a sweep down the body to the low back. And then here we are right at the crest of the hip, the sacral area. There's a lot of tension oftentimes here. This part of the body takes a lot of stress. The vertebrae here at L5S1, a lot of times people will do damage with the discs there. Sometimes the sacrum will move position and people will experience sciatic pain. And then here, going right up the vertebrae, right along the edge of the bones, all the way to the base of the skull. I find that if you take the time to move your hands from origins to insertions, you're going to give a lot better massage than if you stop halfway through a muscle. The lazy therapists will always kind of stop halfway. They won't take it complete, and it doesn't feel complete. If you're going to do that kind of work, you're giving a less than high quality massage. Granted, sometimes muscles are going deep and you can't get to the origins and insertions, but you want to still know where they are and still work them, even though you might not be able to directly palpate them. Now this is some skin or some cross fiber friction going up this muscle of the back that we started with. It's along the rector spinae. It comes into the trapezius and rhomboid area. And then back down. And then what I like to do when I get to the bottom is to just curl my fingers under and just take a brush up through the middle of the back erector muscle, and then brush it through the shoulder, just to kind of feel complete on it. Then, same thing on the other side. This is where having a routine is important, because I've had I've had massages where they don't have a routine, and one side of the body will maybe get worked for 20 minutes and the other side for about 5, and there's not the same thing done. Well, both sides of the body really are like a mirror image of each other, so it's good to do the same thing on each side. Depending on if they're left-handed, right-handed, right dominant, left dominant, whatever, you might find a difference in muscle tone and muscle tension. Pain patterns might come to one side of the body than the other, but primarily they should be still worked with the same type of basic work. Back up and then back. This is probably going to be hard to see here, but this is the one going into the neck. And even though my hands might look like they're moving quickly, I'm still getting very thorough into it. And truth be is, once you practice for many years, your hands are going to move faster and you're still going to be doing a thorough job. But if you're racing through it and you're just beginning this work, you're not going to be able to take it to that level. One thing about this kind of work is it's all about practice, and if you're not practicing every day for many hours, it's going to show up in how your treatments are. People can tell, especially now, because there's so many massage therapists out there. People can tell the ones that are paying attention and the ones that aren't. You can tell that in their load of clients as well. So just a little tip, if you are getting into the business, it's not as easy as you might think. So here we go. And I like to work along the vertebrae with a number of things, because it's a support. It supports us. There's some tiny muscles down there as well. It has many different ways that it moves in the range of motion. And there's a lot of little nerves that come out from there, so it's nice to just get some stimulus and let the muscles relax around a lot of that. And up we go. Now here I just go in and the muscles are separating. And I'm going right up to the vertebrae. And back down, and then a slide up just for the completion. So this is just getting one side then the other. Then to tie the two sides together, as you probably remember in my routines, is I'm on the other side of what I usually do. So this is a vibration going down the vertebrae. And then what I like to do down here is lift the muscle up and away from the vertebrae, just getting deeper down, right along each little spine. It's like rolling your thumb underneath. You're getting underneath it and pushing away, but you're not using a whole lot of force again. You should use as much force where the body's not pushing you back. But if you're going deeper than that, if you're pushing back, then you're just going to create a fight. And if you think it's going to relax on you, it will. It'll relax because the muscles will fail. But as soon as the muscles get back the chemistry that it needs, then it'll still be tight. So if you're working on knots and tight areas, pushing hard on it is not, in my opinion, the best way to take care of that kind of issue. Down and then back up. And then I'm getting to the other side to do another vibration. And then this time I just come straight up the vertebrae. This opens the spine a little bit different than coming down. So you're able to give a little bit different stretch to those tiny muscles. And then at the top, what I like to do is go around the vertebrae. You don't want to be on it, you're going between them. It's very relaxing, it's very nice. It's areas that are oftentimes missed. Getting into the subtle parts, the attachments and all of that make it a lot more pleasant and a lot more thorough. And be mindful that what I'm doing here is more of a relaxation type of massage. It's not really one to deal with injury in this particular technique. It's relaxation, so think about the comments you're going to make. And then what I'm doing next is just to stretch the body down, everything down to kind of complete it. And I'm going to do this on this side. I oftentimes go opposite, but I'm going to just do both on each side. And then pushing down first. Your fingers are a little wide through this, and if you can get between the ribs. You get farther up. And then pulling it back up. This is just like a wrap. You feel like you're wrapping the body. And then a nice way to end is to, what I like to do is just bring my hand up. I'm interfacing somewhat with it, melding into it, and just riding my hand slowly up the vertebrae. Go slow enough on that. Sometimes you'll feel a lot of muscle release, and sometimes you'll feel energy moving from your hand to the back, and sometimes you'll just feel nothing except your hand on the back. Okay, there we have it. There's the back on a male, so please comment, let me know.